Phase 3 of the governor's reopening plan is set to begin next Friday, and health experts want to remind people it's still important to exercise caution as you head back out and about.
Joining us now is Dr. Sharon Welbel. She's the Director of Hospital Epidemiology and Infection Control for Cook County Health. Doctor, let's start with your concerns, if you have any, as the weather gets nice and we head into this reopening phase.
Thank you. Oh, yeah, absolutely. As the weather gets nicer, people are going to be outside and perhaps see people that they haven't seen because they've been quarantining at their own house. But yeah, I do have some concerns. We have to continue to respect this virus. We have to remember that really a very small proportion of U.S. citizens or U.S. people living in the U.S. have been infected with this virus, and we still don't have a vaccine or therapy that works well for this virus. So really, in some ways, we're not in that much of a different place than we were in February. Of course, it's great that numbers have come down and death rates have come down, but that's because of the mitigation that we've been doing by sheltering in and closing non-essential businesses. So there are still some concerns.
Doctor, what do you think at this juncture is the best way for people to prepare, whether their business is opening their doors to employees or these are families who are letting their children and their whole households open their doors again? Where do we begin?
So we still have to follow the actions that we've been doing. Social distancing is important. We have to continue to social distance. You have to think about what is the most common way that we're getting this virus, and the most common way is person to person. So keeping a distance from other people is very important. Masking while we're outside of our homes is very important. Other things that people have been hearing over and over and over again, keeping hand sanitizer with you, keeping your hands clean when you're out of the house, trying as much as possible not to touch your face, your mouth, your nose, your eyes in case your hands have been contaminated. And if you do have to touch your face or your eyes or your nose, to make sure that you're keeping your hands clean and cleaning your hands prior to doing that. Keeping devices clean, like your phones and so forth. Keeping tissue with you. So if you do need to blow your nose or cough or sneeze, you can do that into a tissue and then throw that away.
Do you think we're entering into a phase, I think I've heard it called like risk management or something, where we've sort of given up on confinement and now we are realizing that we're going to have to find a way to live with this virus and we are going to lose people along the way?
We do have to learn how to live with this virus. I don't think that people are going to be able to continue to shelter in and keep businesses closed indefinitely. We know that that is in fact not going to happen as we're going through our other phases and opening things up. But we just have to be careful, continue to be vigilant, and think about, again, how is this virus spread? It's spread from person to person. And now that we know that there are people who have no symptoms, they're asymptomatic, or they can spread the virus before they do become symptomatic, that we have to think about anybody could have the virus.
Very good. Dr. Sharon Welbel, we'll have to leave it there with the Cook County Health Department. Thank you so much for joining us this evening.
Thank you.
Thanks, Doctor.